Thank you. And Mayor Alvey, Yareli Castor will not be in the meeting today. She had a conflict. I think you're muted, Mayor.
I'm sorry, repeat that, Anna.
Yareli Castor will not be joining this evening.
Okay,
He had a conflict.
okay. There's Curtis. There's Commissioner Johnson.
Hello, everyone.
And there's Mr. Mendoza.
Hey.
You know, when all this is done, we're all getting together for drinks.
Lots of drinks.
Now, Reverend Carter, you know, you being a Baptist, I don't mean to impose on you, but I'll have your drink for you.
Oh, I'm sure there'll be a cup of coffee or a Coke Zero or something available. I'm sure. I don't want to miss it. I want to be there too.
Mayor
And
Sheriff
I hate to
Ashford.
report that there are a lot of Baptists who do partake. So
Yes.
I'm just not one.
Okay.
Mayor
Like I
Sheriff
said, I'll have your share for you.
Sheriff Ash will be a little late as well.
Okay, very good. So again, I want to thank all of you for joining and for all those who are Zooming in and who may be watching this on recording. We have two main topics this afternoon. The first will be a presentation by Julianne Van Loo, who is the director of the Wyandotte County Public Health Department. And she is going to describe for us the progress of the Youth Fatality Review Board and the organization of that, the implementation of that strategy, and really describe for us kind of the, let's say, the research framework that supports this approach and how we're going to move that forward. I think that'll be a very interesting topic for us. And then also after that will be a presentation. We've been looking at, you know, how do we work to, in community police relations, how do we work to have our law enforcement reflect the diversity of our community? And so we'll have joint presentations by Chief York and Sheriff Ash with Renee Ramirez, who is the Director of HR for the Unified Government. So before we start that, Commissioner Johnson, if you would please take over and get us through introductions of the members of the task force.
Thank you, Mayor, and thank everyone for being here watching with us today. This has been a full-bodied adventure that we've been on, and I'm thankful that I'm part of it and appreciate the opportunity to be part of this. I am Harold Johnson, Commissioner for District 4, and serve as the co-chair of the task force with Mayor Alvey. We'll go around and do introductions right now, and we'll start with Monsignor Stuart Swetland.
Afternoon, everyone. Monsignor Stuart Swetland. I'm the 7th president of Donley College. It's good to be with you this afternoon.
Great, thank you, Monsignor. And next we have Reverend Tony Carter.
Good afternoon, everyone. Pastor Tony Carter. I am the 3rd pastor of the Salem Missionary Baptist Church, and honored to be so.
Thank you, Reverend. Good to see you today. Dr. Evelyn Hill. We can see your lips moving. We cannot hear you.
Sorry about that. Hello, I'm Evelyn Hill. I'm the Director of Equity and Justice at Avenue of Life. Glad to be with you all on this evening. Thank you.
Great. All right, thank you, Dr. Hill. And Mr. Maximilian Mendoza.
Yes, I'm Max Mendoza, the Executive Director of Heartland 180 Youth Service Agency.
Hello there, Max. And Mr. Curtis Smart.
Hello, I'm Curtis Smart. Recently received my Master's in Public Health Administration from the University of Kansas Medical Center, and also currently a talent acquisitionist partner.
And Chief York.
Yes, Mike York, Interim Chief of Police, the 31st Chief of Police for Kansas City, Kansas Police Department.
All right. And I think that's all, Mr. Mayor. I don't know which succession are you in terms of being mayor?
The fourth mayor of the unified government.
The fourth mayor of the unified government.
Yes.
Good one.
And,
I like, yes, that's right.
And I have to say, the highlight of the evening is always hearing the name Maximilian Mendoza. So we're just, it's,
Absolutely.
The beard and the name go together, Max. So we just,
You know, the Maximilian means greatness, so.
oh, well, there.
No.
Thank you, Commissioner. All right, we like to introduce Julianne Van Loo, the Director of the Wyandotte County Public Health Department, and just recently hired in 2020 at the beginning of the pandemic to be our Public Health Director. And I just need to give a shout out to Julianne for her excellent leadership and administration of the Public Health Department through perhaps the greatest public health crisis that we have faced, certainly that I'm aware of in the history of Wyandotte County. I wasn't around for the pandemic of 1919, but certainly the way Julianne has led us has been a very aggressive approach towards the pandemic, putting into place the testing, the contact tracing, the reach out to the underserved communities, and putting together an excellent vaccination site at 78th and State, and now 2 other sites that were coming into play. And if we could just get more vaccines to our locality, we could even do more. So Julianne brought this Youth Fatality Review Board prior to this time, but we thought this would be a good thing in terms of police community relations, because there is a role that law enforcement can play in this. And we think it's very important. And we wanted to bring this just as an introduction to the community, make it available to the community. So having said that, I'll pass that off now to Julianne.
Thank you, Mr. Mayor, and for all those kind words and for your support throughout this entire pandemic as well. I'm really excited to get to spend some time talking about something that isn't COVID, and of course, something that's near and dear to my heart and our health department's intent to move further into the realm of violence prevention and to be sure that we're playing our appropriate part as a health department. So first things first, why a local youth fatality review board? And we'll talk in a few minutes about what a review board does, but I think it's first necessary to make sure everybody's on the page in terms of understanding there is a Kansas statewide youth fatality review board. It is run out of the Attorney General's office. You can go on their website and look at the annual reports that they release every year, which are helpful to some extent, but there is little to almost no breakdown in those annual reports about local jurisdictional information. So we can see general trends across the entire state of Kansas of how many youth are dying in car crashes, for example, or in a child care setting or something like that. But it does not tell us anything specific to Wyandotte County. And our belief that we are looking to support with data through this project is that it's very likely that youth are dying in Wyandotte County in different ways than they may be, unfortunately, dying in rural or frontier counties, for example. So first things first, we need access to Wyandotte specific information. We need a board that looks at our cases and has a local context in doing so. Secondly, there isn't a multi-sector group that operates in this way. So there are many people working in our community on violence prevention, and we first want to acknowledge them and the great work that they're doing across law enforcement and social service agency and youth services, But there's no group that's together looking at this across silos at both a case-by-case basis and then being able to extrapolate and to look epidemiologically kind of at a broader picture about how youth are dying and in what ways in our community. And then lastly, our intent here is really just to start infusing what we call a public health approach to violence prevention. And this is the way public health intends to approach almost any health issue that we are working on. First, by defining the problem, and we have a little bit of a general understanding of the problem, but again, we only have these high-level statistics. We don't have a lot of detail about the trends we're seeing. So defining the problem and making sure that we all have a common shared understanding of what that problem is, which then allows us to identify risk and protective factors. And so we talk a lot about what is it that puts a kid more or less at risk for violence, right? And we can look at individual cases and find those risk and protective factors. But what we need to do a better job of doing is, again, looking at this as a countywide and at least at zip code and neighborhood levels as well, to identify those risk and protective factors, and then to work to develop and prevent and test prevention strategies that will address them. So that's the general, and then of course, assuring widespread adoption once we've identified those strategies that are working. So that's what we talk about when we say a public health approach to violence prevention. And this is a little bit different than how violence is approached kind of traditionally. This brings with it an understanding that violence is very similar to any other infectious or communicable disease because it is transmitted by close contact. It is transmitted in different ways based on the intensity and the frequency of exposure. So just like COVID, if you're exposed multiple times, if you're exposed for a greater intensity, if you're exposed for a longer duration, your likelihood of actually contracting COVID goes way, way up, right? That we can all understand. We've lived through this pandemic. Violence is very much the same way. Repeat exposure, intensity of exposure, duration of exposure, very much predict further not only experiencing violence, but then actually propelling violence forward, right, or committing violence on behalf of the former victim. So that's just kind of the lens and the framework that we as a health department bring to this project kind of out the gate. But in addition to that, why a local review board that of course then focuses on youth. So if you look across the last 10 years, probably not a surprise to any of you, we average around 33 youth deaths per year, and we are taking a broad understanding of youth, and that for us is age 1 to 24. We think this is really important because individuals age 18 to 24 still have that developing brain. They often experience violence differently than those who are much older than themselves. And some of the trends that we're able to identify are similar to those who are a little bit younger in their youth. And so for us, especially because we know there is a great deal of violence experienced by our 18 to 24-year-olds, it is really important that they are included in this review as well. The other thing I would say on this slide in particular is you can see that deaths are broken down for youth in 4 general categories here. So homicide, which is self-explanatory, accident, the vast majority of which are motor vehicle accidents, but of course there are swimming accidents and others as well. What's written there is natural, and I really don't like that classification, but that's how it's classified at the state and national levels. And those are really kiddos who fall ill from something that it could be influenza and they end up in the hospital and they pass away. It could be a birth defect. It could be anything that's really pretty clinical in nature that leads to a childhood death. And then that last piece there being suicide. So when we look at this from a public health lens and we look at homicide and suicide and accidents, which are really unintentional injuries, you add those up and that really gets us to a place where almost 3/4 of youth deaths age 1 to 24 in Wyandotte County are preventable if you bring this public health lens and approach to this work. A couple of other things that really strike us and that we carry into this is that 3 in 4 deaths are experienced by young men in Wyandotte County. That's an important piece to this, or boys in our county. And secondly, that 36% of those youth deaths involve a firearm. So again, we have snippets of this. We have some high level data, but we don't have a lot of detail about some of these deaths or some of these trends that we're seeing. And then lastly, before I talk about kind of the purpose of a review board, and I'm going to just click through these so they pop into shape, I wanted to lay a little bit of a foundation on where we compare to national averages. The really important thing here to walk away with is that the dark kind of golden color indicates the portion of youth deaths in Wyandotte County and nationally that are attributable to homicide. And if you look nationally, only 12% of deaths age 1 to 24 are attributable to homicide. In Wyandotte County, it's 32%. So just a drastic increase in the proportion of our youth deaths that are attributable to homicide as compared to the country as a whole, and as well as Kansas, if we pull those stats as well. So with that foundation being laid, what does a youth fatality review board do? As I mentioned, its first real purpose is to bring together diverse stakeholders who have different perspectives and different pieces of this puzzle that are required in order to build community that promotes the safety and well-being of our youngsters. So it really first is bringing those stakeholders together, and we'll talk here shortly about who those stakeholders are. But then, of course, to conduct comprehensive reviews of individual youth death cases so that we can understand why they died. So this group of experts does look at individual actual case data, be it law enforcement, be it hospital data, be it school and education or DCF, child abuse sorts of data, to really actually look at the case level of what is happening and to review those cases to determine where there were potential points of intervention. So that's this next piece here, the third bullet, to provide analysis and evaluation of trends in deaths. So what are we seeing across these deaths? What are the commonalities? What are the differences? What does it look like over time? What does it look like geographically across our community in terms of how these deaths are spread out, what the means of death is, and just really making sure that we have an epidemiological lens when we're looking at this and understanding that yes, every single case is unique and different, but there are by and large certain commonalities that a lot of these deaths have that we need to identify. And then lastly, fourth, providing recommendations for intervention and community supported action that can prevent future deaths. So of course, the entire point of all of this data collection and evaluation of cases and identification of trends is to find those points of intervention that we think could actually be implemented at the local level within our local context that can prevent future deaths. And these interventions or community actions maybe involve one organization. It could be a change of practice at KU or Children's Mercy or the police department, or it could be these cross-jurisdictional, cross-silo interventions that need to happen with us working closer in partnership to make sure that our kiddos aren't falling through some of the cracks that we know exist in our current system. The last thing I'd say on this slide, of course, is that we want to make sure that everyone understands going into this, that this youth fatality review board does not have a purpose of placing blame anywhere, be it on the victim, be it on other survivors in that particular accident, be it on a healthcare provider or a law enforcement agency. That is not the point. And in fact, none of the conversation will be geared that way. The point of this is for us to collectively, again, review these cases and find points of intervention that we can proactively build upon. Real quick, I just wanted to let folks know we conducted a pretty robust community survey of 132 social service, healthcare, law enforcement, faith-based organizations about this youth fatality review board concept and what we were thinking of doing, and disseminated it through some of our channels in the health department. And just wanted to highlight what the people who responded to that survey have said that they would like to see the goals of this youth fatality review board be. And these aren't written in stone yet, because when the board formally meets for the first time in the next couple of months, they will work together to really solidify their goals and to ratify them as a group. But what the community has told us they want to see is obviously that this group needs to inform community strategies to prevent youth deaths. That's pretty clear. Then to reduce unintentional and intentional injury deaths in age 1 to 24. And then thirdly, very high on the list for the responses as a whole is to reduce racial and ethnic disparities in youth deaths, specifically caused by homicide and suicide. And so the community has identified these as being their priorities, or the priorities that they would wish this youth fatality review board would adopt in conducting their work. And I have a whole bunch more information about this survey and the responses, and the type of information we gleaned was really telling, and I'm happy to share the further results of that survey if anybody is interested on this task force. Membership is, of course, supremely important. And so we've gone about doing a lot of that relationship building this year. You can see in the left-hand column are who we call our core partners. These are the partners that we literally just cannot have an effective functioning review board without. So of course, the health department and coroner's office have to be at the table, the DA's office, KCKPD, who has already committed themselves as well, and the sheriff's office, who has already committed themselves and have been at this table. There are a number of healthcare providers, the big ones, of course, KU and Providence, that we have to have at the table because they will have be the ones with the central medical and health records that we need. Wyandotte Behavioral Health Network, as we know that youth suicide is also a piece of this puzzle. USD 500, who themselves have launched a pretty robust violence reduction initiative that we want to closely partner with, and a couple of others. So those are the ones who We've met with all of them this fall. We had a kickoff meeting to talk about what kind of data we would need people to bring to the table. That's always the sticking point for our legal departments, because this is protected health information that we have to figure out how to share in a really careful way. But then additionally, on the right-hand side, you can see here when we conducted the survey that I just mentioned, we asked if they wanted a seat at the table, if they would be interested in being on this review board. And we have not invited all of these organizations formally to the review board in any way yet, but I wanted you to all to get a sense of the many organizations who have already stepped forward and said, yes, we would either like a seat at the table, or we'd like to be kept informed, or we'd like to be involved in some way. And again, we had almost 140 responses to that survey, and just I think we were really surprised, especially in the comments that people wrote in response to that survey, of how interested people are in this, how hungry they are for additional ways that we can work collaboratively in the violence prevention realm. So what are the next steps for us? So as I mentioned, we've got a lot of our data sharing agreements in place. Our law enforcement agencies have come to the table in a really productive way. We are finishing getting into those agreements with KU and Providence that both are willing to sign off, but have to go through the final legal checks. The school district and Children's Mercy are at the table. So what we're trying to do now is figure out our first formal convening in March or April. There are a couple of 4-ish priorities that we're trying to really push through the spring so that we have a fully functioning youth fatality review board by sometime this summer. And the first of those is to continue to push for legislative modifications, because right now there is state statute in Kansas that explicitly allows the state youth fatality review board to have access to this protected information, but does not extend that to the local level. And it would be really helpful for us if that piece of legislation was modified so that out the gate we have coverage at the state level in terms of being able to share that information. So we're working through a couple of bill options with Mike Taylor, our UG representative in Topeka, on that. We are continuing to finalize data sharing agreements with those core members that I mentioned. We do need to solidify membership, and part of that will be the Youth Fatality Review Board themselves, identifying where the gaps are on that board. There are key seats on the board that we have kind of held, for lack of a better word, aside that we know we need to fill. It is our intent to have at least one, if not two, parents on the board who have lost children to youth violence, and a couple others like that, where we know we need to have these other voices at the table who are not on that core kind of membership list of big, large organizations, but whose viewpoint will substantially change the conversation in the way that we review these death cases and how we talk about this. And then we're working on reaching out consensus on our bylaws and all that kind of administrative stuff of how often will we meet and how will we choose which cases we review and what will our annual report be. All of that still has to be put into place, but we're working hard in the background on behalf of the health department to move those administrative pieces along. So that's kind of all I have planned. I think I would leave you by just saying we are not experts in this. I've never launched a youth fatality review board. Our health department obviously has not. This would be the first fully functioning youth fatality review board in the state of Kansas. But we really are strongly committed to this. And we hope to come to the table in a way that people feel wanted at this table with us. We don't want to do this in a way where we're encroaching on others' territory. And again, our intention in no way is to ever place blame, but to hopefully be a powerful force to make sure that we're using a more preventive based model as we approach youth violence in Wyandotte County. So that's all I've got, Mr. Mayor. Happy to take questions. You're on mute, sir.
Thank you, Julianne. Any questions for Julianne?
This is Monsignor Swetland. Julianne, thank you. That's very helpful. And this is important work. I was wondering if you know, just from has anyone done the work? If guns went away, so many of these deaths have a gun involved with them, be it accidental suicide or a homicide. Not all homicides, not all suicides, not all accidents, but such a large percentage of them. If guns went away, what does the studies say about the decreasing in those rates? Obviously, someone who's really determined to harm somebody else would find another way, or someone who is really determined to end their own life would find another way. But if the guns weren't readily available, what decline is there anticipated in these kinds of preventable deaths?
That's exactly the kind of thing we need to dive into. All I can say at this point in time is that there is, about 36 or 37% of youth deaths over the last 10 years have explicitly involved a firearm. I think it would be one of the goals of the group to look into those firearm related deaths and figure out where the trends were there in terms of, the actual situation where a firearm ended up being discharged and ended up killing someone. So I don't have a good answer, but I see that as part of the purview of this group is to figure out the various methods of the way children are dying in our community. What does it look like if we add barriers to certain methods? How will that impact other potential injury or death? And I can't say right now, but our hope is to do some of that exact sort of fact finding.
Julianne, this is Evelyn. Just a real quick question. Could you just give a little more information on the legislative modifications you mentioned earlier? Are there any bills already on the floor? Is this something you're wanting to actually start?
There are two bills, and I just received word from Mike Taylor late last night that one of them is not going to move forward, but there is still one that we have an opportunity to push for. And I'd be happy to find that actual bill number and send that to you along with kind of a high level overview. But really what it's trying to do is something very simple, is to take the exact language that's in there right now that provides this allowance at the state level and just include the phrase "and local municipalities," right? So at the state level, there are all of these mechanisms in place for data to be automatically funneled from various law enforcement agencies and DCF and others to the Attorney General's office. And so they are sitting there with all of the data for every youth case, including all the Wyandotte County cases. Now, the most simple, effective, straightforward solution would be for them to pass that information on about our cases to us. Obviously, we don't want other county cases, we only want ours. The Attorney General is not in favor of that and has made that clearly known to us. We're not really sure about motives there, but we do think we have some traction, and we've met with local representatives the folks who represent us in Topeka, and we have strong support from them. And so they are going to push forward, and I believe that there is a hearing on a proposed bill as early as next week. But again, I can find that out and send that to this group as well. In the meantime, because we were afraid that we wouldn't be able to pass at the state level, we've just gone ahead and tried to enter as many MOUs as we could get willingly. And as I mentioned, KCKPD and others have stepped up and done that of their own volition. What we're having the most trouble getting is a data sharing agreement with the Department of Children and Families. So those child abuse cases or anything else like that, we cannot get access to that data, and that is state-owned data, and they've made it very clear that they do not want to share that with us. So we're worried that if we aren't able to move at the legislative level, we'll just have that core piece of data missing around the DCF information. So we're working hard to get all the other data in place, again, because there's a lot we can do without it, but the much simpler solution is to make this legislative change at the state level.
Ms. Van Loo, this is Pastor Carter. Thank you again for this document and this information. I think it certainly sheds light on something that all of us kind of in the back of our heads already knew. But I guess what stood out most graphically for me was the disparity or the difference between what's happening here in Wyandotte County compared to the national levels. Anything you can say that stood out to you guys as you were compiling this information to formulate that graph?
We're blown away too. I mean, we knew out the gate that the leading cause of death in Wyandotte County between the age of 18 and 40 is homicide, right? So that wasn't surprising to us, but to see it compared and for us to have 32% of our youth deaths attributable to homicide versus 12 at the national level, I think that's at the very heart of why we have to do this review board, because we don't have good detailed information as to the why. And I think for us from public health, it's got to start with the why, and it's got to start with a shared understanding. We came to it just like you, Reverend Carter, is we know instinctively that this is happening. We see from the school districts, we see the headlines of the youth dying in our community. We know in our guts that it's real and it's among us, but we haven't done a good job of connecting a lot of these dots and breaking down some of these silos and bringing this data together. And so my hope is that that's the right avenue for the health department to get better engaged.
Hey, Julie, this is York.
Hi there.
So did you look at the national average is what, 12, you say, for youth?
12% of ages 1 to 24 deaths. Yeah.
Okay, so did you look at what Kansas City, Missouri is? Well, I'm sure as one can be, every metropolitan area probably has the same problem as Wyandotte County does, versus the smaller communities don't have these issues. So, I mean, I think it's a lot of it is the urban
Absolutely.
issue, not so much the smaller towns and the smaller cities across the country aren't having the youth violence and the gun violence that we're having. So I just wondered if the national average, I mean, that includes absolutely everything, not just, I mean, it'd be interesting to find out, I guess my point is, what is the average for urban areas like ours?
Yeah, that's a great question. And I don't have that in front of me. We did look up KCMO, and I want to say it was in the upper 20s, much closer to our 32%, obviously, than 12%. But your gut about the rural urban divide is exactly why we find the current Attorney General's report so unhelpful, is because this aggregate data for the state of Kansas just does not speak to our situation. But yeah, I think you're right. And I think there are a lot of other urban areas making some progress that we could learn from in some of these areas as well.
Hello, Curtis Smart. Thank you again for this presentation. It was really, really impactful. So I have a question. How has the revitalization of the Wyandotte County parks impacted maybe some of those rates of youth fatalities? And are they, is the revitalization of maybe our parks and recreational centers helping with reducing those rates of youth fatalities?
A really good question, and I don't have a good answer, but what I can tell you is that we have entered into a grant in partnership with KCKPD, and we've been awarded funding for an epidemiologist to spend time devoted to looking at this data. And I think one of the first things they plan to do is a much better mapping for all of us on where what types of violence are happening. And it would be easy for us to add on layers in terms of what park modifications have happened, what improvements, and see where the where the overlap are between some of those modifications and improvements and what we're seeing in trends. So I don't have a good answer for you on that either, but I think we're in a place where we're able to actually start diving into those questions here shortly with our new epidemiologist.
Thank you.
Hey, Julie, this is Max Mendoza. I know that this is still really new. We're still kind of establishing the whole process. I kind of want to ask more about end game. So once this board is up and going, we're collecting data, we're starting to see trends. Do we have, like you mentioned those MOUs, are there agreements or systems in place that once we have this data, something can actually be done with the data? Because one of my biggest concerns is if we collect this data, but we don't have the partnership from those different key points and implementation of what we find, I would like to see those relationships already being built, or before we, when we get to that point, we can actually do something with the findings.
Absolutely. Great question. A lot of them, the youth fatality review boards that exist across the country, they operate off of the same model as FEMR, which some of you might be familiar with, which are fetal infant mortality review boards. And those review boards evaluate deaths age 0 to 12 months. And we, in fact, have a FEMR fatality review board. The model for those is that you have one arm that does the case review. They're called a case review team that look at the actual deaths and the actual data. And they have a second separate but kind of tied together arm called their community action team that then is charged with taking the findings of the review team and implementing those. We played around with that model and considered launching both kind of aspects of this review board at once. And we quickly realized that there would be too much duplication. So we have had pretty in-depth conversations with both the KU's Thrive Youth Violence Prevention Project and the CHIP, the Community Health Improvement Plan's Violence Prevention Team. And both of those teams are ready and willing to have 6-month meetings where this board reports out to them and they take on of their own volition their commitment to kind of implementing some of the findings. So our current plan is to utilize existing collaborative groups that are doing youth violence prevention work to bring our findings to them and work in concert with them rather than setting up a whole new group from scratch.
Okay. And will those findings and data be publicly released too?
Absolutely. Our intent would be to bring those forward to commission, to do an oral presentation, to publish a formal report on the website, and to do other kind of community-based presentations to make sure this information actually gets to the neighborhood level as well.
Thank you.
Julianne, it just occurs to me, you know, and I've spoken to this about this before, Max, to your point, what I am encouraged by this is, you know, I've had numerous individuals come to me whose children were victims of violence and were killed, and I have no answers for them. I can't bring the child back to life. I can't tell them what I know is going to solve the problem, and it's frustrating. And to really take a public health approach, to really look upon this as, you know, from an epidemiological perspective, I think is empowering, because first of all, it's a framework for us to understand this, that as a model, it captures so much of the experience, maybe not all of it, but as a model, it's always limited, but it's going to capture much of the experience, but then also is going to be able to drive some strategies so that we can reduce, you know, by the time an act of violence, you know, by the time law enforcement shows up on the scene, the violence has already occurred, and they're just as frustrated, and there's nothing they can do at that point. What also occurs to me, it's interesting, and I'm comparing this to the COVID pandemic. If we just look at the number of people who have died from COVID, that's one statistic, and we've come up with better mitigation or strategies to treatment protocols for those who are serious risk of death. But all those who have other conditions. So you look at the experiences, the incidents of violence that do not result in death. That's another, you know, it's frightening to me to think, if this as number reached death, the point of death, just think how many incidents of violence do not reach that, and that tends to be cumulative. So again, epidemiologically, the more incidents, the more adult children, you know, experiences of trauma in a childhood, you just continue to collect those, and they form you and make you more susceptible to either commit an act of violence or be a victim of violence. And I think this is just going to open things up for us and be helpful for us and empower us really to do something to halt the spread.
Mr. Mayor, if I might too, just Alan Howes to add, you know, if you look at the breakdown, almost a third of the fatalities are also in the accident category. So while certainly violence is a very big part of this, there's another part that deals with kind of the built environment, and are those vehicular crashes, or, you know, bike or pedestrian, or any number of sort of different ways that those those fatalities happen, and are there intervention strategies that could emerge from a better understanding of that, that would, you know, also reduce those, as those, you know, devastate families, you know, in lots of different ways as well.
Absolutely. This is, I mean, of course, homicide is a big piece of this picture, but I agree. It needs to take a really comprehensive and holistic view. And our suicides are slowly trending up among our youth here in Wyandotte County as well. And that's another place where there are well-known evidence-based interventions that we could employ if we have a better understanding of what's happening. So that's a piece to not forget too.
Well, Julianne, this is Reverend Carter. I think one of the important things, one of the important decisions you guys made to approach this from the vantage point of not assessing fault is very key. I think that was a very wise decision, because that can easily muddy the water, and that can cause complications that really impede the whole process of what you're trying to do. So I really want to compliment you guys for approaching it from a non-fault finding approach. I think that was key.
Thank you. I'm glad to hear that. I mean, we really approach this as we have all collective responsibility. Every single person on this, you know, call has collective responsibility, and as does the health department. And we make missteps too in how we serve our clients, right? And so we can all improve in what we're doing without assigning blame. And in fact, by removing blame, it actually gives us a lot more freedom to get creative and to work collaboratively. So agreed. Thank you.
And just real quick, a quick question and also comment on this. I think it's really important. I'm glad to hear that you guys are looking to have the parents of, children, that have been victims of violence or death from violence or youth death. But my question on this is, what is your process, or how are you going to find those parents? Are you guys going to open this up for the community people to try to apply to be on this board, or how are we going to identify them? And then to make sure, also, I would like to see that we're looking at the demographics of this. Where are higher numbers coming from, and are the people that are going to be serving this board represent the demographics of where we are seeing these increase in those areas?
Sure. The issue of membership is a sticky one, as we know it's really imperative to get that right, or we may not see the level of success that we want to see. In answer to your first question, Dr. Jamela Watson-Thompson, who I know you know with the Thrive Youth Violence Prevention Project, had identified a couple of parents that she knew have really jumped into this space since losing a child, and who have really indicated a want and a willingness to stay engaged and to make sure their kids' stories heard and all of that. And so we were going that way rather than kind of opening it up. It feels weird to open it up to some sort of application. We wanted to tap into those who we knew were ready and willing to tell their story, because many are not, and that's completely okay too. We would never want to push people in that direction. The second thing I would say about membership is that we don't see this as today we're going to determine 20 agencies that are going to be in this review board for the next 5 years and that's it. We see this as a little bit more fluid, right? So we've got our core members who have stepped up to the table and committed. We'll likely bring on another 10 or so representatives of parents and school and social service agencies. And then it will be the responsibility of the review board to be continually kind of assessing where are the gaps on this board, who is not at this table. And especially once they get their first year under their belt and they start to look at trends, to your point, they may realize that there are demographics not well represented that they need to go ahead and shift. So it's our intention that this would be a little bit of an iterative process as we work over the first year or two to get that membership settled. Great questions.
Thank you, Julianne. We've taken a lot of your time, but we appreciate this and we look forward to what you gather.
Awesome. And I think I sent the PowerPoint to Anna to send to all of you, but if any of you, as you take this back and think about it overnight, have questions or suggestions, again, this is new for us too, so please don't hesitate to email me directly with ideas or thoughts on this. So thank you for your time. Take care.
Thank you. All right, we'll now move to the presentation on the inclusion and diversity and recruitment. I think I'm going to pass this on to, I believe this is a joint presentation by Chief York and Sheriff Ash and Renee Ramirez. Is that correct?
That's correct.
That's correct.
All right. So I will shut up and let you all go.
Okay. Thank you all for giving us this opportunity to explain our processes to you. This first slide here really represents for us, the collaboration between the Unified Government Human Resources Department and the Police Department and the Wyandotte County Sheriff's Office. We continue to enhance our collaboration efforts between these three departments, so that way we're always looking at best practices for how we recruit individuals to the unified government. Anna, do I have control to switch to the next slide? Okay. I'd first like to start off with one of the policies that's listed in the Human Resources Guide, which is the equal opportunity employer. It's the policy of the unified government to ensure that all applicants for employment and staff are aware that the unified government is an equal opportunity employer, and that we have this policy posted throughout our buildings. It's on our website so that everyone is aware of this. We work to ensure that our processes are fair and consistent, to ensure that we are selecting the most qualified candidates to join the UG team. We strive to have a centralized location for all candidates to submit their applications and resumes, which is the Human Resources Department. We partner with our departments to take them through several processes during the selection process, that being the Police Department and the Sheriff's Departments. All of our policy regarding, the guidelines that we follow are posted on the Human Resources webpage. Our policies are on the UG website as well, and you can find those policies by clicking, going to WICO KCK and then /jobs. And then on the left-hand side, you will see the Human Resources Guide. You will also see all the labor contracts that we have for the 13 bargaining units that we have here at the Unified Government. But basically, the equal opportunity policy basically states, that it's the policy for us not to discriminate against any employer or applicant for employment because of race, color, national origin. And, I won't read it on the screen, but the full version, again, is available at the wicokck.org jobs. The next slide that we have for you is the application process. We pretty much mirror the same application process for police and for sheriff. We've taken some of these processes and really try to enhance them and really deliver customer service to our applicants. Applications can be picked up, dropped off in human resources. A lot of times they're submitted online because of COVID. We actually moved to more of the online process, which 2020 drove a lot of us to change some of the processes from that person-to-person contact to the online versions. Testing packets are provided to applicants in person. They're given to them by mail, or they're hand delivered by our partners in the police department and the sheriff's department. And those testing packets will include study guides, information that they need to have to get through the testing process. Human resources responsibility in this portion is to collect all the documents from applicants for these files. That would be like birth certificates. Some of them may require transcripts. Some of them have DD-214s if they had prior military experience. Applicants now are able to sign up for testing dates. It used to be that we used to recruit once a year for candidates for police and for sheriff. But one of the initiatives that came out of the previous task force was that we needed to have more testing dates available for our candidates. So we moved to a monthly testing schedule, which you will see. Human resources, police, and sheriff staff administer the written examinations and the physical agility tests together. And again, we also, HR participates with police and sheriff in hosting preliminary interviews. That's part of this process. The next slide is going to represent the testing cycle and the deadlines that candidates will follow. Again, we are holding more opportunities for candidates to actually test and go through the process for us. When they submit their application, they get to choose the testing date that's going to be most convenient for them. I do have Sabrina, who is part of my staff, who is the public safety recruiter, who is on the line too. Applicants can choose that. If an applicant does fail the test, they have an opportunity to sign up and take the test again. So they can do that for up to 3 times. But this just shows the number of tests that our departments are actually hosting for individuals to participate in. The next slide is going to talk about the written and the physical agility. The written examination, again, was developed by Standard & Associates. It is a validated test. Both exams have been validated by Standard & Associates. There are security protocols that staff have to follow when we are administering these exams. So those are strictly followed for each of those processes. Applicants are provided again with study guides for both exams. So they will have a study guide for the written examination, which would be comprised of, I believe it's 4 sections like arithmetic, listening comprehension, there's probably a report writing, and there's one other section that's just losing my thought right now. But there's 4 sections to the written examination. The physical agility is examination. That study guide is also given to those candidates, so that way they know which are the timed sections for the candidates that they'll have to meet and which are the untimed. The physical agility is going to give each evolution and give explicit instruction on how to maneuver through those evolutions in order to pass this test. Unfortunately, due to COVID, last year we were unable to host like voluntary walkthroughs, so that way candidates can actually touch and feel the equipment and get direct instruction from our rank and files on how to maneuver through those evolutions. We are now going to be placing a lot of those instructions online, and the chief and Sheriff Ash will probably talk a little bit more about what's going to be on our website to help the candidates better understand what to expect when they're going through the physical agility examination. Again, the voluntary walkthrough sessions are hosted by our departments, and that's really to help those candidates kind of work the nerves out and really find out how they need to prepare to get through that vigorous test, because it is a vigorous test that they have to go through. The cutoff levels for the written examination, we have a 70% overall is a passing score. When we get those results from Standard and Associates, they are given to the unified government in alphabetical order. We don't know exactly the scores that each candidate makes. We just know that 70% and above, they all pass. So they're not categorized into who got 80%, who got 90%. The cutoff levels for the physical agility exams are the police department, they have to pass it in 1 minute and 37 seconds, and the sheriff's office is 1 minute and 38 seconds. And the sheriff's department is one of those initiatives that we just completed from the previous task force, where we had standards come in and develop that test for us, and it was validated as well. And so that is one of the things that we're using now to assess our candidates for the sheriff's office.
Hey, Renee, this is Alan House. Just going back to one thing, if I just, for folks who aren't as familiar with it, explain what it means to be a validated test and why that's kind of important in the process, because that word means something kind of fairly specific in this context.
Yes, so having a test validated is important for us, because if we should ever face a challenge, then if we should have to go to court, it's going to have all the data that's necessary to support that we didn't have any kind of adverse impact in our testing that we're giving to our candidates.
Right, Renee, this is Don, and I'll just add here, excuse me, to that end, I know that these 2 written tests have been court tested and passed and stood up to the court challenge. I believe the police department physical agility has been court challenged. I can't speak 100% to that. The one we're using in the sheriff's office is so new, nobody has challenged it yet. But then again, we have had very few applicants that could not complete it. I can think of, probably count them on one hand and have fingers left.
I'm going to kick the next slide over to Chief York to talk about some of the best practices that they're doing for the police department.
Anna, would you put the, there you go, Anna, thank you. So, we do marketing. The ways we're doing it, I don't want to blame it on COVID, but we're doing a lot of Zoom hearings now with the college universities and the kids. Our last recruit drive, we actually went to the university and saw the kids in person. So that's been a little bit of a change. But we are moving through that, and we are still going to all the local universities, all the regional universities that we've had success with in the past in getting police applicants. So, I took about 3 or 4 officers off the streets, and I put them in the chief's office, and their sole function is to do nothing but recruit and try to find the best possible applicant for the PD. So I have two African-American officers and 2 white officers that are doing nothing but recruiting. So that's been a big help. They are working on, making videos, putting them on our website, and showing what a great job being a policeman is for the KCKPD. So we're also doing the social media stuff. We're doing digital billboards that we're hiring. We do a thing called geofencing. So when like KU and K-State, when those guys graduate in May, our website will pop up on their phones, letting them know that we are hiring. That's just one example of geofencing. It's a pretty good idea. It's a good way to use technology to get the kids out there. You know, they all have smartphones and they're all looking for jobs. So our website will pop up on their job searches. What we've done in the last go around, we streamlined our testing, which is huge. For the applicants to be able to take a written test, the physical agility, and the interview all in the same day, that is huge. That means they don't have to come back for those tests. So we have streamlined, with the help of HR, we have streamlined our testing process. When kids come in or applicants come in from out of town, we are getting them in and out in just 1 or 2 days, and they can complete the test within 1 or 2 days. So again, that's a way to streamline the process and hopefully get these kids hired. A couple other things we've done to retain our applicants before the academy starts would be, if you pass all the tests and the academy doesn't start till July, but here it is in March, we're going to hire you as an auxiliary officer. So that way some other agency won't snatch them up and hire them. So we can get them hired. They'll be working security at City Hall, and they will just work, get paid until the academy starts. That's been a really successful program. Just to keep them employed and get them paid is a move in the right direction for us. So we've also lowered our age to just apply. It used to be 21, now it's 20. So we're getting kids, 1 or 2 years out of high school, and they can apply for the police department. They don't have to wait until they're 21. Next slide, please, Anna. And these are the places we've went so far. Again, you can see a lot of it's virtual, unfortunately. We have Officer Marche London, who has reached out. She's one of our recruit officers. She's reached out to the NAACP and all those organizations there. As you can see, Thrive, the Baptist Ministers Union, trying to get African-Americans, specifically African-American females, to apply. We have not had any African-American females in the last couple academy classes. So we're going to, or actually going to, through virtual, go through Lincoln University and Harris Stowe, which is all African-American kids. So hopefully that will help. As you can see, we're pretty busy by going to all these places. And we're using our social media, trying to get the kids to apply to the PD. And next slide, please. And these are just the things we've done for the recruitment materials. As you can see there, we've gone to Northwest Missouri University. That's on our social media. So we've changed our look just a little bit when it comes to our flyers and our postcards and our posters. So that's really all I have, and I'm open for any questions or any suggestions with the hopes of getting some diverse applicants.
Chief York, thank you again for your presentation, and Ms. Ramirez, thank you all for this information. I think it's quite helpful. Chief, in regards to a statement you made, you said that there were 4 officers who were taken off the streets who are working out of your office just to do recruitment, and you made mention that 2 of them were white, 2 of them are African-American. And I'm assuming that by your use of the word, they are recruiting the best possible officers. that the African American officers as well as white are just recruiting the best officer, not the white officers recruiting white officers and the black officers recruiting black officers. I know that's your intent, but I just want to make sure we say that because you use the term best officers, and I just want to make sure you clarify that that's the case.
You've clarified it. That's what I meant to say.
Thank you.
Yeah. Thank you for letting me know that.
Chief York, this Monsignor Swetland, I just want to thank you and everybody for the presentation. And also to note, because it was alluded to earlier in the presentation, that we have now seen the implementation of many of the recommendations from the last task force, which I had the honor to be part of. The streamlining, the specific recruiting, the expanding of testing, the lowering of the age. Those were things that we recommended from that last task force, and it's great to see that they've been implemented countywide. There were other recommendations, and I know you've addressed these other things that go more into the weeds. If you remember the 2016 task force, we did find there was some real issues in the psychological testing and some of the other steps that recruits had to go through where they weren't using validated testing. So it's very important for the public to know about the validated testing, because that's key to making sure that what we're asking is both fair and just to all the recruits involved. And I look forward to you all being back at Donnelly College. I think we have our recruiting fairs coming up in March and April. And I know you've been in the past at them, and I hope you'll be here again. What do you think, as someone with so many years of experience here in serving our local community, and obviously someone who cares about trying to seek that diversity of all sorts for our first responders across the board, what's the main obstacles that we as a community have to overcome to help our first responders writ large look and reflect more what the community itself is like?
Monsignor, this is what I believe. When I was applying back in 1990, there was 500 people applying. That's for 2 days of testing that we filled the Jack Reardon Center. It was a good job to be a policeman. We had people respected us, and kids, young kids like me at the time wanted to be policemen. I honestly think, maybe I'm wrong and you guys can correct me on this, but people do not want to become police officers in this day and age. They see the negative press, they see what we go through, they see officers being fired or for making a bad decision, or getting indicted for making bad decisions. I just think if somehow we can change our image, people from the community, because we have a very diverse community here in Wyandotte, but we're not getting people that live here that want to be policemen here. And I really think it starts with changing our image, and we're slowly doing that. But when you have things like George Floyd happen, and you have his trial coming up, and I don't know what that's going to bring, but we're preparing for it, is that kids, and this is a great job, great benefits. It's one of the best jobs in the country. But with the negative feedback that we're getting from the media and social media, it's tough to hire, and for that matter, to hire diversity. I hope I answered your question. I mean, maybe I didn't, but
I think it's an important discussion that we have. And I know there's some discussion too at the state level right now we're under a constriction that only someone who are already citizens can apply. There is some movement towards loosening that, so someone who's has legal documentation but may not be fully a citizen yet, much like in the armed forces that I served in. I had people serving with me and some of my men that were in my division and department when I was on board ships. They were not yet fully citizens, but we allowed them to serve. Do you think that would help?
You know, if the state of Kansas can tweak that legislation where we can do that, man, I think that would be a step in the right direction for the police departments across the country.
Yep. And I just have to say on a personal level, as someone who, being a priest, we have some of the same issues in recruiting new priests. So I do, in a real sense, feel your pain on this. And I do think for people to understand, I joke about the priesthood, the pay is low, but the fringe benefits are out of this world. It's such a rewarding vocation and career. And I know that that's how, having talked to many of your colleagues and yourself in the police department, that's the way people see it. And it's a great way to serve the community. We do need to get that word out if we're going to have the kind of community policing we want.
And Chief, I think the things that we're doing today, even though there are a lot of people who discount the Community and Policing Task Force, but I think these kind of initiatives and these kind of efforts over time will have a positive impact on what we do. And in general, I think people support good police officers, always have and always will, just like people support good pastors and good priests because of the work they do, because of their understanding of the role that they play. And there are bad pastors just like there are bad policemen. And so I think for the most part, if the police departments and law enforcement and all of us and all of our endeavors continue to do our jobs with integrity, and again, we're human, all of us can make mistakes no matter where we are, where we fall on that whole conundrum, but people generally support good police officers, good sheriffs, good pastors, good priests, good administrative assistants. I don't want to leave anybody out. All of us are in this, and generally people support those people who do their jobs with integrity and humility. And as long as those things are evident, it will come to bear in the way that it should. Yes, there's been a black eye because of some of the historical things that have happened, but we'll overcome this and we'll be better and we'll do better. And hopefully that comes sooner rather than later.
Thank you, Pastor Carter. I appreciate that. And I truly believe what you just said. That is absolutely the case. It's not if, it's when. We'll make the turn. It's just going to take a while.
Chief?
Interim Chief, this is Evelyn.
Yes, Evelyn.
Thank you. And also the HR department for the updates and comments. One quick question. I appreciate what you all have done as far as testing and all that. What is there any other incentives that you are presenting to minorities and women, or is there anything else, any other bonuses, opportunities, or incentives that you are offering?
Well, so not to the new recruits, but if a officer that's on the PD right now, if he can recruit somebody and they pass the test and they're in the academy, they get $500. That's not bad. Just have one of your buddies come in, get him a job. He passed the test, he passed the academy, he's got $500 coming his way. But to answer your question, do we give bonuses, sign-on bonuses to people entering the academy? No. I mean, that's just, now, I know other agencies have done that to pull officers away from other agencies. Johnson County at one point in time was giving, Johnson County Sheriff's Department was pulling officers away from like Marion, Roland Park, Overland Park, offering them more money and a take-home car to get them to come to Johnson County Sheriff's Department. So that does happen, but we're not at the point right now where we're offering financial incentives to join the academy. It's a pretty good paying job. It's $48,000 starting. I mean, they get pretty, in 3 years, they're making $60,000. They're making pretty darn good money. But I don't think it's the money, Dr. Hill, right now. It's going to get people to come to the PD.
Chief, could you speak to the role that the Police Athletic League is playing in bringing young people into relationship with, law enforcement, so they can see and experience up front, the personhood of the police and what they do and why they do what they do.
Mayor, that's a great point. And I'll tell you, the PAL has been open for 2 years now, and we're going to be paying dividends with the PAL in about 10 to 15 years because they have about 900 kids signed up. And they are interacting daily with 2 to 3 officers, boxing, computer skills, learning computer skills. You know all the things they do over there. They're getting ready to put a little pickleball soccer field out there. They're getting ready to start a driver's ed program. Which actually, when Julianne was talking about how a lot of these kids are being killed in wrecks and accidents, a lot of these kids don't have driver's license. Mom and dad have not given them the opportunity to go learn how to drive. So they just get in a car because they're 16 years old and they start driving. So the PAL is going to offer a driver's ed program here soon. That's just one of the many things that the PAL is doing. And the positive interactions day in and day out, these kids are ranged from 7 to 18 years old. We're going to see kids coming to the academy that started at PAL. And that's what, that's in a nutshell, that's what PAL is all about, is to have positive interactions with the police officers and the police department, with the kids in the community. So, I would encourage everybody on the task force, and we can set something up to go visit the PAL. To see it is to believe it, and you got to see it. The things that they're doing there, they're wanting to renovate the basement and open up that area and have kids, start a dance studio. There's so many things that the PAL is going to do and they're doing right now. There's such a positive thing for the community.
Chief York, this is Max Mendoza. And I definitely, I have to say the PAL is a huge step in the right direction, I think, with the relationships with the community. Another program I think that was really great that I'm hoping is still going on was the OK program.
It is.
I know okay, great. I know we at one point had a great relationship with the officer who was running the OK program between my agency and that group. One of my questions I'm wondering too is, are these programs, could they possibly help with diversifying the employment of our police department, with those youth getting a chance to see the police department a different view? I'm pretty sure there's probably some older kids that are coming through some of these programs, or past youth that have gone through these programs, that maybe these relationships could continue going in some way. But to me, I think there's an opportunity here for helping change the look of the police department, redeveloping those relationships, and having that next generation come into the roles as future officers.
Oh, Max, absolutely. That's what the PAL is all about, is to change that. And Missouri has done it for 25 to 30 years, and they've had a lot of success stories with their PAL. But, to go back to your question, I need to connect you with Rodney Boston. He is our PAL officer, and he's relatively new, and he's working his way through it. But let me get him connected to you, because he works here in the chief's office, and with the kids and the crazy schedules with COVID and all that, the OK program is not as good as it once was. So and that's life right now with COVID. He's not doing as much as the OK officer once did.
Yeah, I mean, we're in the same boat as well with our programming, but I just think, these are those opportunities where we can establish relationships and help change the stereotype or the view that I know I struggle with youth that I serve on how they view police officers.
Right.
And so the more positive engagement that they have, the more opportunities to build these relationships with our young people, I think gives us better grounds for helping change the whole relationship between our community and police officers. It's one of those things that takes time, and we got to put in the groundwork for it, so we can reap that harvest in the future.
Agreed. Evelyn, I have some numbers for you if you'd like. You asked the question on email about a few things, and I have the numbers if you'd like for me to share them with you. Okay, so
Thank you.
yeah, no, you asked in the police and fire. Now, I just have police numbers. In the police and fire departments, how many minorities and women have been promoted to high-level positions in the last 2 years? So we've had 5. 1 female, 1 white female to deputy chief, 1 white female to major, 1 Hispanic male to major, and 2 Hispanic males to captain. Your second question here is, well, I've already answered that. What incentives are made available for minorities and women to be hired? None right now. You asked what percentage of the PD minority staff has been promoted in the last 24 months. So we've had 26 promotions in the last 2 years, 10 minorities. So that helps answer some of your questions. That's about 38% of the 26 promotions we've had in the last 2 years, 10 minorities, which is about 30% minorities.
Thank
How
you.
many of those minorities, Chief, were African Americans? And again, I'll point out that you mentioned the 5 who have been promoted to upper level positions. None of those were African American either. Can you address that for me as well?
Sure. To answer your first question, I'd have to look. African American promotions in the last 2 years, we've had 2 females, 1 black, 1 white, and 1 black male. Detective rank. And that's it, Pastor, for for African American promotions. That's it. We only have, I'm gonna be, just to let you know, and you probably already know this, we only have 1 African American captain. We have several African American detectives and sergeants, but the problem is they are not wanting to take the test to become captain. We have a lot of great African American detectives that would be great captains. Same with sergeants that would be great captains. With our contract, with our FOP contract, they have to take a test to be promoted to captain, a written test and an oral board test. And then they get ranked, and when positions come open, I promote. So that's where we are. I mean, I will tell you, you know this, maybe other people don't, but they don't want to leave there's a lot of detectives and sergeants that don't want to leave the union and become management. It's just the way it is right now. That's the way it's been. Don Ash can chime in, but that's the way it's been for a lot of years. They don't want to leave the protection of the union. Now, a lot of them are thinking, I have a day job here. I'm a detective. I work 8 to 4. I have weekends off. I make overtime. I have a take-home car. I make captain. And then the chief puts me on midnights. They don't want that. A lot of people don't want that. Doesn't matter if you're white or black or male or female. A lot of people want to stay where they know that they can bid for their job and they can have the hours that they want and the days off that they want. That's the dilemma that I'm in.
Keeping that paid overtime is big too.
Yeah, yeah, absolutely.
For them, there are many detectives and sergeants that on an annual basis will make more money than the captains and sometimes the majors that supervise them.
Gentlemen, let me say this, and again, I understand all of the red tape and the rationales behind people not. And I guess I'm pointing this out because you guys know as well as I do what it looks like to the community, and we've got to have. I don't know how you do it. I'm not saying I know, but we've got to, at some point in time, we've got to break through that ceiling and someone, the chief, another fellow officer, I don't know who it is, but someone has got to convince some of the African-American detectives or whomever they may be, somebody's got to have enough positive impact and influence on those persons because they have got to help this community get over this hump, to get out of this rut that we're in. And I'm not saying I'm not looking for fault. I'm not saying it's anybody's fault. I'm just saying in order for us to get past this, someone has got to step up to the plate. And again, I'm not saying this should be the chief. I don't know. But somebody has got to be able to use their impact and influence to encourage somebody to step over that line so that we can begin seeing these numbers move in a direction that's going to incur more trust from this community, particularly the African-American community. That's all I'm saying. Again, I'm not trying to make anybody uncomfortable. I'm uncomfortable even saying this, but I think if we're going to ever get to where we're building that trust, that ceiling has got to be broken for whatever reason. Because I don't believe that all the African-American officers in here are motivated clearly by money, because they can make more money as a sergeant or as a detective than as a I don't believe that. I know that there are people who are committed to this community and love this community. We just lost the OK program that I worked with. We just lost an excellent officer to promotion. And I wouldn't hinder that young man because that's why he joined the police department, to be able to progress and go up in the department. But we lost a great officer, but I understand that process. And I think that there are persons who would be willing to do that for the sake of this community. And I guess I could be proven wrong, but I'll shut up.
I couldn't agree more with you, Pastor. And I had a situation just a little over a year ago with an African-American detective that I offered 2 different promotions to captain, and he turned them both down. And once again, I didn't want to make it sound like, well, they get to make that overtime versus, straight hour, 4-hour comp time. It's not always just, an issue of money. the ages of their children and where they are in school and the activities that they're engaged in. If they can pick, as Chief said, if they can pick that Monday through Friday job and have all of the holidays off when their kids are out of school and their wife's not working or their husband's not working, and they are enough in seniority that they can get the prime vacation days that they want, and they can be there to watch their kid who plays volleyball, basketball, wrestling, golf, soccer, baseball, softball, whatever it is, they'll say, I'm not taking that promotion. I'm not taking it right now anyway, because of all of these things in my life that are more important right now. And I begged this young man, I begged him on both occasions to take this promotion. I said, I don't know if I'll have another opportunity to promote you during my term as sheriff. We do not have an African-American captain. I have 2 African-American female captains. I don't have an African-American male captain. And I can't promote him above captain if I can't get him to captain. If they won't take it, you know, you can talk logic all day long, but people have their logic and they have their reasons or whatever. And sometimes when that opportunity passes, that's it. I mean, that's it. It's gone. And in this particular young man's case, some other events took place and now he's not in a position to be promoted, you know, to captain, and likely won't be, you know, for a while. And so sometimes when that ship sails, it's gone. And I'm telling you, I begged this young man. I've known this young man since he was a teenager and worked with him in sports programs from the time he was a teenager.
Sheriff and
He
Sheriff Ash
should
and Chief
get
York.
captain. And so, you know, I mean, there are lots of reasons. You're right. It's not just money, but there are other reasons why they have passed. And it doesn't make sense to me. It doesn't make sense to Mike. But, you know, at the end of the day, you get to make your choices. You don't always get to choose your consequences.
Sheriff and Chief, but this is one of my, back in 2016 when I was on the other commission, the first one, police commission, this was one of my frustrations. I heard the same kind of history, and I suggested that we think, if that's true, why can't we open up positions to bringing people from other police departments who are qualified in at the middle management level? And I was shot down that you have to start at the square one at the academy to work your way up in the local police. And I know that nationwide that this is splits departments. There's departments that allow people to transfer. There's departments that don't. But why shouldn't we, for a little period of time, perhaps, change that rule so that we can change the dynamic in some of our department or some of our areas of our departments?
In our cases here, Monsignor, you have to get the union to agree to it. So if we can come up with something that's large enough or huge enough or big enough that the union would agree to it, then we could do it. But the way these contracts are written, they have to come from internal promotion. And Mike, I don't know if you want to add anything to that, but until we can figure a way around that or over that or beyond that, I don't see a way.
You're right, Sheriff. The obstacle would be, you know, the union contract and there's a process in place to become a detective and a sergeant, and there's a process in place to become a captain. Now, I guess, Monsignor, I could go outside and say, hey, I want him as my next major. That's me bypassing a lot of really good captains here on our police department. And then, you know, the learning curve behind that when it comes to being a major on the police department, a guy who's from Overland Park, whoever, or from Kansas, Missouri, it wouldn't be efficient. I guess that's what I'm trying to say. It would take him, 1 to 2 years just to learn how we do business. and then the personalities that are attached to his structure, his command structure.
I know we've had people leave. Are they allowed to come back? You know, leave to go to other places. Are they allowed to come back?
As a commander?
Well, just whatever level would be appropriate to their.
Yeah, we hire people back. I've done it quite often. I hired a white female. She left. Her husband got a job in Arizona. They moved back, and I hired her back. Let me touch real quick on.
Interim Chief York.
Go ahead, Dr. Jill.
This is Evelyn, interim chief. You mentioned the testing earlier. My question is, the minorities that are up for that could possibly take the test, are they challenged maybe with the test being too hard, or is it just they're not interested, or in your opinion, and do you offer tutoring or anything like that? I'm just asking crazy stuff, but I'm just trying to understand what might be the hindrance even there.
Yeah, no, I don't think it's the hindrance is not being smart enough, I guess, to pass the test. That's not the hindrance. I mean, the test is not that complicated. It's police processes and police procedures. They know all that, you know, so it's not like it's something they don't know. It's something you got to go and study our general orders and brush up on all those kind of things, and you'll be fine when it comes to taking the test. So, you know, the tutoring, you know, a lot of officers study together. So that would be, you know, more in lines of the tutoring thing. But yeah, actually, it's funny you mentioned that, because not one person has ever said, hey, chief's office, why don't you offer some tutoring? Not one person, just because they know the business. They've been around long enough to know the business. They just have to take the time to hit the books and brush up on what they already know.
Chief York and Sheriff Ash, I apologize if I implied that you guys were at fault. That was not my intent at all. I believe you, Chief, and Sheriff Ash, I know you guys have probably had instances where you did try to convince people. So that's not what I'm saying. I'm just saying we, and I'm including myself in that, we got to do a better job of using our influence and impact so that we can finally get over that hump.
I'm sending them to you next time.
Yeah, and then the other thing that I think, when we use the term, Chief was saying we had 26 promotions, and then he went straight from the number of promotions to we had 10 minorities. It's as if we're hiding behind the word minority, because that's part of the criteria, but we are avoiding saying we had 1 Black, 2 females, and 2 Hispanics, or whatever the case may be. I think we've got to get this stuff out on the table to where we are. What's the problem? What the real issue is staring us in the face and forcing us to come up with creative, innovative ways to address the issue. And the issue is our community. Chief York said it himself. When he did this 25 years ago or 20 years ago, there was a room of 500 people. Now we haven't had 500 people want to be on the police department in the last 10 years. Well, maybe that may be stretching it a little bit, but I'm just saying there's a trust issue in the community. And the way we're going to best address that issue is by having some small successes. If we had 1, 2, 3, and we just start having some small successes, over time, that image, that trust level will increase. And I don't know, again, how we do it, but we've got to figure this thing out. And Monsignor said I look prayerful. Monsignor, now you understand why. Because we've got a lot of work to do with every avenue that we have access to for the betterment of the community that we all live in, that all of our children live in, and our grandchildren will be raised in. We've got to use every tool we have available to include, maybe you can't say this publicly, but to include prayer, because I think it's going to take that kind of initiative, that kind of drive to be able to look back on this and say, this is how we in Kansas City, Kansas were able to do it. But we got to have some small successes to start that process.
Yeah, and I agree totally, Pastor. And, you know, Donnelly College, we're the most diverse college in the entire Midwest, but we've had some great successes. Johnson Westbrook, who's now a White House fellow, went from us to the police. He's an alum twice over. He got 2 degrees here and came back to teach after he got his master's. So we've got successes, but we've got to have
program officer as well. So we take part, we're part of that.
Right. But we have to have more of those successes. And we have to, you know, help the community recruit. This has got to be a broad thing. And we have to also make it people proud to be a police officer again, because they're serving the community, just like I served in the Navy. And I'm proud that I got the chance to put on the uniform and serve my nation. Now I wear a different uniform and serve, as a Catholic priest. But the idea of what the officers do, they literally put their life on the line for us every day. And we that has to, again, be valued. I'm wondering about the economics. If that is an issue, then we have to look at that as well. But we have to help people see that that's a calling that some have.
Hey, Pastor Carter, just real quick, I'm not sure if I told you this, but I promoted Jonathan Westbrook to sergeant. So when he comes back from DC, he'll be wearing sergeant stripes.
Yeah, y'all don't know this, but when we interviewed Jonathan Westbrook to take over the OK program, I predicted that day that one day Jonathan Westbrook would be the chief of police. So it ain't too late. It could happen.
Good. He has to take the
So
captain's
we've had
test,
some
though.
excellent young men to come through the KCK Police Department, and I've had the privilege of working with a couple of them. Palmer McCurry, who is still on the department, it was an excellent officer for the OK program. He represented the Kansas City, Kansas Police Department in a high valued way. I mean, he really was a great young man, as was Jonathan Westbrook, and the other officers who've worked for the program as well have been good quality people. But somewhere we've got to be able to convince some of those young men to stay the course. Somebody's got to be Jackie Robinson, if you will. I don't know. That may be going back, because we have had an African-American chief, Boston Daniel. I know the history, but that's been so long ago that that's forgotten. And we've got to have some modern day Kurt Floods or Jackie Robinsons or Fritz Pollards. This is Black History Month, right? I can do this, right? This is Black History Month. I'm just saying, guys, and again, I see it is not just your problem, it's my problem too. I see us in this together, and I'm committed to making it happen. And I'm already talking to young men who are in elementary school or middle school about being police officers and what an opportunity it would be to, it ain't just about money. That we've been talking about the money part, and that's what everybody's motivated by, money, because that's how our society is driven. But there are things that are more important than money. And we've got to begin planting those seeds now and wherever we're able to apply and use our influence. And I just want to be a part of that.
And I agree with you so much, Reverend Carter. For me, I think one of the biggest things, it goes back to those relationships. We have to establish the relationships to change the culture, to change the image, and it all goes back to those relationships that we build. And, for me, I hear about these officers that we have that may not want to move into leadership, but maybe that's where, I don't know if there's a way, maybe there could be some sort of way to build relationships with those officers or find out to help motivate them to move into those positions of change. For me, a lot of it comes down to to those relationships that we build with the individuals, with the community, with one another, to help influence us to want to make those changes, to realize we are a part of a community and that we do have a responsibility to our communities to make it better. One of my biggest, I just heard a phrase the other week that really caught me was, nothing's going to change unless something changes. So, we need to start with some sort of change, and that change is going to start with each one of those individuals. So I think that's an important thing. That was kind of one of my last thoughts I really wanted to get out. Unfortunately, I'm going to have to jump off of this meeting now, but I think that we are finally in a position where we're taking the right steps. And we're moving, I feel like we're in a position where we can start moving forward, but to see the real effects of that is going to take time. And so I think we need to realize that, and to continue that forward progression and not let ourselves take step backwards. So I do have to say this, Chief York, I've been very happy with the POW program. I'm very excited and interested in reconnecting with the OK program. But those are the kind of things, is building those relationships, getting our youth involved, and just making those small steps moving forward.
This is Evelyn again, just real quick. There was a survey put out for the new police chief, and I just want to know from the HR department, from that feedback and from that particular survey, or how are we using the feedback? When I say we, how are you, the HR department and the police department, using that feedback from the community survey as you're looking at hiring a new chief?
Well, from the HR department, and I'll probably pump a little bit of this to Alan House from the county administrator's office, but some of the information that was received from that is what helped us build the profile for the candidates that we're looking for. And some of those things will be implemented into the assessment center that the Human Resources Department is going to be working on, that we're going to be hosting here pretty soon, to take the candidates for the next police chief through.
Yeah, and I just add to that, I mean, I think getting that feedback and understanding I think it sort of tracks to concerns that have been expressed in the community that I think have come out in this forum as well, and kind of using that as a way to both sort of, I would say, set questions, and how would the incoming chief respond to and situations or certain questions, certain priorities for the community. So I think it's really kind of helping to set and clarify what those priorities are, so that those can be used in the evaluation process and the questions that are developed, and as Ms. Ramirez said, the kind of the profile of the candidates that are selected through that process.
Ms. Ramirez, when you say you're using some of that information for your profile, can you explain to me a little more detail what that means? What areas? I'm probably not asking the question right, but hopefully you understand what I'm trying to say.
Yes, well, we worked with a third-party vendor to actually build the brochure that we used for advertisement for the next police chief. And so it had different criteria in there, like things that we were looking for in the next police chief. So there's like a candidate profile, there's different qualifications that we're looking at, things of that nature. We just kind of fed into that a brochure that this third party developed for us. And that's how the candidates kind of learned about the police department, the initiatives, the goals, and kind of what this community is looking for in this next chief.
So Ms. Hill, maybe to kind of give you an example, would be, from the community survey, if the community survey indicated that community policing was an important component of a overall kind of policing strategy, and a candidate that was applied didn't have any their experience or, in community policing, or somehow otherwise indicated that that wasn't a priority for him or her in their strategy, that would kind of give you, that's how that information gets used from that community survey is, here are the things that community says are important, and how do those kind of relate to those candidate profiles, if that makes sense.
Okay. Great work by everyone. Thank you, Chief York, Sheriff Ash, Mr. Ramirez. We appreciate your work on this. We have our internal meeting, I think, is on it. We've got it scheduled for a couple of weeks out. We need to kind of take a look forward, see the horizon for the task force, and expect that meeting to go longer, probably about an hour. And Commissioner Johnson and I will get together and kind of brainstorm that meeting to see what the next steps are, and really continue to explore topics. But again, what I keep coming out of just to that this is just an ongoing conversation. I know it's interesting, we've been referring to the previous task force and whether that conversation was consistently maintained. It needs to be, because it has to be. It's just not going away. Community police relations, we want it to continually improve, and the communication is necessary. So again, and Reverend Carter, Pastor Carter, you mentioned that people have criticized the task force. Honestly, I'm going to say this for anybody who's listening. If they want to insult me, they can go ahead. I think it's reprehensible that they would insult the integrity of the individuals who've agreed to be a part of this task force. Each one of you have come to this with good faith, with honest discussion and commitment. And it's really, I find it reprehensible that people would cast aspersions on the work of the task force because they're really saying they don't trust you. If they want to say that about me, it's fair game, but it's really unacceptable. I'm just saying that because I hear it myself, and I don't think it's fair. And anybody who wants to call and talk about this, call and talk to me about it, because each one of you has brought something special to this, and it has helped move this conversation forward. And things have changed because of this. So again, I just want to say thank you again for all your work.
Thank you, Mayor.
It's still light outside. Get outside. It's still warm.
Thank you, Mayor.
Thank you all.
Commissioner. Thank you, Mayor. Thanks, everyone.
All right, everybody, have a good night.